Let's look at a separate component of this. So the second thing that people worry about is not necessarily that their kids are going to have a death or a suicide, but that they're going to become demented. So what exactly is the relationship between concussion and dementia? The reality is that recent surveys have showed that 1/3 of Americans have had a concussion in their lifetime. The majority of people who have concussions are males. Dementia occurs at 63.5 per 1,000 persons. Alzheimer's is twice as common in women versus men, even though men are more likely to have had a concussion. 5 million Americans have Alzheimer's. There's no reliable diagnostic. There's no known cause. The other types of dementia that we have to think about are vascular dementia. Vascular dementia is when your blood vessels don't work very well. So you get impaired blood flow. And you see that in people. We'll talk about the risk factors for that. Frontotemporal dementia and normal pressure hydrocephalus. So what are the risk factors for dementia? What causes dementia in the elderly? High blood pressure, number one. Diabetes, sedentary lifestyle, so not participating in sports is a risk factor for dementia. High-fat diet, alcohol use strongly. Female gender, women are twice as likely as men, despite the fact that women are less likely despite the fact that men are more likely to have a brain injury. Low socioeconomic status, strongly associated with dementia. Smoking, cardiac problems, genetics, decreased level of education. That's the most important one, particularly for women. So there's been epidemiologic studies that show that if you have a mild brain injury and you're over the age of 65, and you're a male, you're more likely to have dementia. And if you have a moderate or severe brain injury and you're over the age of 55 and you're male, you're more likely to have dementia. And that's from a California epidemiologic study. So if playing in sports doesn't necessarily increase your risk for dementia, then what is this all about, chronic traumatic encephalopathy? Because that's what, it's all over the newspapers, and people seem to think that, chronic traumatic encephalopathy is the reason that they shouldn't allow their child to play sports, so that, because their child will end up with that. So let's talk about what it is first. It was discovered in 1928. It was discovered by a pathologist who was studying boxers. It was published in the Journal of American Medical Association, a very prestigious journal. It was found later in 17% of living professional boxers, and it was named CTE in 1969. So for those of you who saw the concussion movie, it's not quite accurate. The name came about 40 years or 30 years before Bennet Omalu, wrote his papers. It was classically associated in living people with motor deficits, that means coordination problems, and with dementia. The pathology was described in the 1960s and 1970s at Queen Square in England. So the British sort of had described what the brain looks like after someone's had multiple repetitive brain injury, and it was something that they originally picked up in boxers. Then what happened is, in America, there were two different groups that started working on this problem, and they identified what they called CTE in two different patients in the United States, and this was in the 2000s. So the first group was Bennet Omalu's group. As you know, they were based out of Pittsburgh. And this is what the movie Concussion was about, was the Mike Webster, sort of finding that he had CTE. And then the second group was Ann McKee's group in Boston, and for some reason she didn't get to have a movie made about her, but she described, CTE in athletes, progressive tauopathy after repetitive head injury. So when these two papers came out, and particularly when this first paper came out, what happened was the pathology that they described was not the same as what had originally been described in the British boxers. So the British were really mad. And they actually said that, the reason that this paper shouldn't have been accepted is that it's not the same disease. What you're describing is something completely different, and we're not sure that this is the same CTE. And in fact, they were so mad that they wrote an editorial in the British Medical Journal saying that CTE, as defined in America, is not a neurologic entity, but is a cultural specific social phenomenon. And so that editorial was published in the British Medical Journal, and there was a lot of brouhaha. And then the Canadians wrote a paper saying that their retired football players with multiple concussions and neurologic symptoms also didn't have CTE. And then this ended up in a current sports medicine report where someone questioned, is CTE even a real disease? So then, at that point, there was a lot of confusion. So there were all these pathologists in the United States saying, we're seeing CTE in athletes. There's this British group that says, we're seeing CTE, but it's not the same CTE as what you're talking about. So what they did was they all got together and they had a meeting. And the meeting happened in February 2015, and it was sponsored by the NIH, so it was the NINDS, NIBIB. This is a federal organization to define CTE. And what they did at that meeting was they decided on 4 types. And they said there are 4 different kinds of CTE, but the first 2 don't cause any symptoms, right? So you've got 4 different types of CTE, the first 2 don't cause any symptoms. So then the British went back and they looked at their database of all their brains that they had. You know, they have this huge pathology group at Queen Square in London where they've got literally thousands of brains. And they said, okay, if that's what you want to call CTE, we're going to look at our brain bank and we're going to see how many people have CTE. And what they found was that the prevalence in people with neurodegenerative diseases, approximately 12%, was the same as in normal healthy people, where it was actually slightly higher at 13%. So in other words, there was no difference in the CTE findings on pathology between normal healthy people and people with dementia. And the patients with CTE died at a mean age of 81 years and were likely to be clinically asymptomatic. So in other words, they've described a disease that doesn't have any symptoms, according to the NIH criteria. It's found under the microscope in equal proportions of healthy, normal, asymptomatic people as it is in people with dementia and other diseases. This was published in Acta Neuropathologica, December 2015. Then, I'm sure you guys all saw this paper come out of the Mayo Clinic. It happened about the same time, that basically said that if your child plays football, he has a 1/3 chance of developing CTE. And I'm sure a lot of you guys saw this because it was all over the media. And, you know, like if you read the newspaper, it's like, oh, hey, it's right there. The reality is if you read the fine print on this paper, what they show was that they found CTE pathology in 21 out of 66 former athletes. 3 of those athletes had had prior concussions. It was not seen in non-athletes, of whom 33 had documented head trauma, but the clincher is there was no association between clinical symptoms and CTE. So in other words, they're describing findings, you know, in the brain that they see underneath the microscope in dead people that don't have any symptoms. So it really raises the question of, if CTE has no symptoms, should we really be worried about our children having it? And so this paper just came out, JAMA Neurology, basically saying the existence of CTE as currently described is not universally accepted in the community. And then it goes on to say that it could be related to normal aging. And then it says post-mortem studies of symptomatic retired professional athletes have described changes, you know, other than CTE or mixed changes in other neurodegenerative diseases. So, you know, this is published in JAMA Neurology in March 2016. So this is not like me just making this up. This is the scientific community. This is a very respected group out of the University of Michigan, basically saying that we've got to stop talking about CTE and start talking about what's going on in living people. So let's go back, now that we're done talking about CTE, let's go back to living people. And let's ask the question, if you let your child play football, are they at increased risk for getting dementia? Because that's really what I want to know if I'm going to let my kid play football. So does football increase your risk of dementia? And the study that's been published followed 438 football players for 50 years. And it compared the kids who played football to the chorus, the glee club, and the band. And what they found was that they had the same risk for dementia as members of the chorus, glee club, or band. And in fact, clarinet players had the highest risk of Parkinson's disease. So, you know, you've got to realize that, you know, playing linebacker in high school probably carries less risk than playing clarinet in high school. You know, that's not a good way to decide that you should not let your child play contact sports. You know, so the problem is that when you look at what's getting published in the newspapers, it can be very, very confusing. And I think the reason that this is happening is that people who do research on brain injury, they have to get grant funding. So in order to get grant funding, they have to say, we've got a problem, right? And the way you make yourself have a problem is you go to the media department of your university and you say, I've just written a paper, and my paper shows that if someone plays, you know, if someone has brain injury, they're going to have a problem. And then they link it to football. And the reality is that you can't necessarily link it because they don't always do the studies properly. So this is a paper that came out, J Neurotrauma, again a very respected journal, in March 2016, followed 93 former football players and said that cumulative head impact predicts later life depression, apathy, executive dysfunction, and cognitive impairment. So all of the things that you don't want your child to have. And the reality is that the way this study was conducted is with no controls and with what they call an ascertainment bias. So what an ascertainment bias is suppose I have this room, all of you guys, maybe I have 100 people here, and you all played football all your lives, right? And some of you guys had 10 concussions, and some of you guys had 1 concussion. And I go over there in the corner, and I open up a clinic. And my clinic studies near point of convergence, or some sort of abnormality that can be associated with brain injury. And I say, okay, I'm opening a clinic for near point of convergence. And anyone who has a near point of convergence disorder should come to my clinic. And suppose 5 of you randomly happen to have near point of convergence disorders, and you come to my clinic. And the rest of you, 95, you all stay here. And you've all had various exposure to sports. And I study you 5 people over there in the corner, and I look at the impacts, how many impacts you've had. And then I say, okay, the guy who has the most impacts has the worst near point of convergence. Well, I haven't studied the other 95 football players who don't have near point of convergence. That's what's called ascertainment bias. And that's what makes the studies invalid. And so this is, I'm not saying that, football doesn't cause problems. Of course it can cause problems, and I'm going to talk about exactly what those problems can be and how we can treat them. But the reality is that some of what's published in the scientific literature is not necessarily rigorously done scientifically. Football is the sport played most frequently by neurosurgical department chairs in high school and college. So 33% of neurosurgery department chairs played football in high school. 1/3. That's a really, really, really high number, because only 8% of high school students in general played football. A very significant percentage, 12%, played high school in college, so college football, and that's only 0.7% of college students. So in other words, neurosurgery department chairs were 16 to 40-fold more likely than the general population to have played football in college. That's a really high number. So that tells you that football probably has some sort of psychosocial or complex benefit that allows these people to succeed. I suspect it makes them more resilient. 30%, so what do neurosurgeons, what do brain surgeons do with their own children? 30% of the children of neurosurgeons have played contact sports. 83% engage in other risky sports. So biking, skiing, snowboarding, skateboarding, we see all of this. And if you survey neurosurgeons and you ask them, should football be banned? The majority of them are saying banned in elementary school. You're getting 80% for boxing, but for football, for tackling, you're getting about 57% or so. Banned in middle school, banned in high school. Only about 10% of neurosurgeons are saying that football tackling should be banned in high school. So it's a relatively small percentage. Banned in professional sports, again, a relatively small percentage. The majority here are saying never banned. There's a large group. Off-piste skiing, the majority are saying never banned. Because if you're going to start banning sports, then you really have to think, okay, why would you start in the middle of the spectrum? You should start with the more dangerous sports. So the reality is, and my sort of take-home message, I don't consider myself pro or against football. I'm against brain injury and pro brain health. And I'm pro making good decisions for the psychosocial development of my child. The reality is that greater than 1 million children, American children, play high school football. It's the most popular sport in high school. Track is second, basketball is third. There's another 1 million children that play Pop Warner or other league football. This is a lot of children. And if even half of those children are like my son, who tells me that if I don't let him play football in the fall, he's not going to do cross country or soccer, and he doesn't have the skills for those sports, he's not going to participate in team sports in one season of his school year. He's going to sit at home, and the resultant increase in sedentary lifestyle risks are enormous. Hypertension, obesity, diabetes, these are the things that cause long-term lifetime risks. So, and there's been data to suggest that even the obese child sees, the very fat child sees cardiovascular risk reduction benefit from sports. So what do? We know that our kids are going to play these sports. We know that these sports are dangerous. What do we do next? My favorite recommendations on this are from the American Academy of Pediatrics. I think they've done a really, really brilliant job putting out their position statement on tackle football. And the things that they say, follow the rules. You know, if you see illegal hits, if you see illegal contact, you know, say something. You can't be doing that. Reduce the contact in drills and practices. You know, there's no reason for kids to be butting their heads against each other. There's absolutely no reason for that. You know, we know that the sport has inherent risks, but we shouldn't be pushing our kids to do things that are dangerous. We know that the brain is precious. We need to protect it as much as we can in the context of still allowing our children to be active. Neck strengthening. There's no data to support it yet, but there's a lot of evidence suggesting that women may be particularly vulnerable to concussion because their necks are not as strong and they have less inertia and their heads bouncing back and forth. Tackle technique improvement. So using rugby style tackling, the heads up training, you know, that's the important stuff. This is how you prevent your kids from getting brain injury. You know, pulling them off the field is always a possibility, but it's better to let your children be active. And then the most important thing is obviously when an injury occurs, a kid should have proper care. So let's go back to, you know, the spectrum of types of problems that can occur after brain injury, and let's look at this objectively. Why should your kid get help after they have a brain injury? Like, if your kid is playing football and they do get hit in the head, you do need to seek care, and that's the most important take-home message. And that is because most of these problems are treatable. So spinal cord injury, depending on how severe it is probably not going to be as treatable. But muscle injury in the neck, you know, these things are treatable. Endocrine dysfunction, 100% absolutely treatable. You know, if you get it diagnosed, your kid can get better. Inner ear injury, again, treatable. Vestibular rehab, these are things that can help make kids better. Cortical spreading depression, treatable. You give a kid electrolytes, you give them medications to restore the neuron balance. You know, you don't have to live with these problems. You have to get help. And you have to go to someone who knows how to diagnose this. Scalp injury gets better on its own. Skull injury, unless it requires surgery, gets better on its own. This you can treat with surgery or it'll resolve on its own. Subarachnoid hemorrhage, intraventricular hemorrhage. This is where you start to worry about things that are not going to get better. You're going to need rehab for this, and you're going to need rehab for this. And anoxic brain injury, we don't yet have treatments. So what my research lab focuses on is distinguishing amongst these different types of injuries so that we can target therapeutics. So we're interested in how we can diagnose these problems using things like blood tests and eye tracking to figure out what's wrong with the brain so that we can treat patients with these particular types of brain injury that are a little harder to recognize and a lot harder to treat. So that's really all I have. You know, if there are any questions, I'm happy to entertain them. I know, you know, it's a gorgeous night, so I would totally understand if you all want to get home to your kids. Thank you.
So at this point, there's time for questions from the audience, and I'm just going to ask you if you could repeat the question so that it gets on the
Sure.
video. That'd be great.
Yeah. Yes.
Thank you very much for coming. That was great. My name is Glenn Miller. I have a son going into 8th grade. I guess, what is the effect or impact of, I don't know how to describe it. I and others I know have had lots of like Randy Bell, like the seaside.
Yeah. Yeah. You know, the reality is that every single child is different. If your kid is constantly having that problem, I would probably get my kid checked out. You know, I would probably take them to see someone like, you know, like our brain injury rehab group and just make sure that everything's okay and make sure that they don't have a problem. Because the reality is that once you have a brain injury, you are more likely to have a second brain injury, and you're more likely to have a more serious brain injury. So, you know, if your child is having a repetitive problem where they see stars often, I would probably take them out and get them checked out, you know. And you can often, there are a lot of different tests that we can do to check for function. And, you know, you want to get your kid sort of, you know, tested in all the different ways, you know, for balance, for eye movements, for endocrine function, you know, so that you can know that there's nothing wrong before you have your kid continue to participate. because you don't want to have long-term problems. Yeah, you know, every concussion is different and every kid is different. So we know that, you know, these problems are not always the same. Like if it happens once, it may not be the same the second time. So I would err on the side of getting it checked out. Well, the reality is that there are so many different organizations that have defined the word concussion that it's going to be hard for you to know which one to follow. So, you know, for example, the American College of Rehab Medicine has a definition, the Zurich Conference has a definition, you know, neurosurgery has its own definition. So depending on how you define concussion, that may or may not be a concussion. If you call it a transient loss of neurologic function, you know, then yes, it's a concussion. So, you know, I would probably take it pretty seriously. Yeah.
So I just want to follow up from a VA perspective and a high school perspective. We follow the CDC concussion training, which says when in doubt, sit them out. So if your child sees stars, they're not going back in the game, regardless of what level they're playing here in Stillwater.
Yes. Oh, yes. Yeah. Yeah, I mean, so the most commonly used tests are IMPACT and King-Devick. And I personally don't think that either of them is a great test. IMPACT, you know, my child has had to take multiple times, but if you look at the literature on it, the problem is that there's huge variability in performance depending on how your child feels that day. And you know, with my kid, for example, they always make him take it either during lunch or after school or at some point when he'd rather be outside. And you know, he doesn't put his attention, you know, towards doing well on it. And so you get very variable performance. And then when you have developing children, you know, kids who are in school, their brains are very much evolving all the time.